Here to downtown, but expect that to go up. Outbound 19 minutes with some congestion going into O'Hare on this Monday morning. On the outbound Eisenhower, traffic is tight approaching Des Plaines Avenue. Inbound still looks okay. That's traffic. I'm Jim Calamonte on AM 560, The Answer.
Chicago's Morning Answer continues next. AM 560 Weather Center forecast with our AccuWeather meteorologist, Steve Williams.
Sunshine and clouds, the high today 76, clear to partly cloudy tonight, low 61. Sunny, nice couple of days for tomorrow and Wednesday, the high tomorrow 80, Wednesday's high 83. Plan with confidence, download the redesigned AccuWeather app today. I'm Steve Williams on AM 560, The Answer.
61 at O'Hare. Next news at 6:30, and Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
From the Matrix Home Solutions studios, this is Chicago's Morning Answer on AM 560, The Answer.
Listen to AM 560 The Answer online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, and on TuneIn, iHeart, and on Odyssey. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560 The Answer.
Top of the morning, Dan, and in for Amy J this morning, John Kass, johnkassnews.com, Chicago Way podcast.
Thanks, Dan.
Thank you. And John, you're in trouble at the CDC when you're starting to lose those who were actually promoters of lockdowns initially, like former FDA Commissioner Scott Gottlieb. And they're starting to lose them because the last week in particular has been such an excrement show. It really has. Culminating on Friday night with the interview we previewed on Friday morning that Bret Baier would do of Rochelle Walensky, Dr. Rochelle Walensky, the CDC director. And he did. Here's the explanation you get from Walensky on the change in mask guidance.
So what we did is we looked at other sites that were conducting outbreak analyses and discussed with some international colleagues who are ahead of us on the Delta variant to see what we could glean. And what became very clear is that the data that we saw in Massachusetts were corroborated in numerous other places, and that's when we knew we had to take action.
It's all about Provincetown.
Where's the study? And, okay, we talked about this during the break. There's so much going on with this mask, not mask. You're going to have your kids mask again. It's not going to kill you. It's going to kill you. Cases up. It's coming so fast. The average guy like me, I think of myself, an average guy on this, I can't make heads or tails out of it. And it's kind of like listening to The Baby at full volume, and I never have. You want to turn it down. And just like, what did the White Sox do?
Well, here's I think you're right. I think that's a good point. And so what's the reaction? If you're trying to listen and assimilate all this information, the takeaway you get is that they're all over the place.
Yeah.
And there's nothing succinct sort of top-line takeaway. So on mask guidance change, that was explaining the change, kind of, sort of. And here's something else, too, which wasn't asked but should have been. How do you make a change without showing your work first or showing your work at the same time?
Right, where's the study?
There wasn't any, and so you're fishing around for, exactly what the CDC is saying, as Bret tried to do. Again, how does wearing a mask, which the vaccinated didn't have to do, and they're now recommended to do, how does that help them?
So for the masks to be added to that, are the vaccinated people wearing the masks to protect the unvaccinated people, or are they protecting the vaccinated people?
The vaccinated people, so if you are vaccinated, when you are vaccinated, you are protected from severe disease and death. And when we removed the masks in May for the vaccinated people, the Alpha variant was the predominant variant. And we had data to suggest at the time that if you were infected as a breakthrough case, that you couldn't give disease. You couldn't give Alpha disease to someone else. Fast forward now, the end of July, the predominant strain here is Delta. And so what the data that we saw was actually unlike like Alpha, Delta allows you to transmit to somebody else. So the masks are really being put on for vaccinated people in areas of high density disease, such that if they were to get infected, that they knew that they might bring it to somebody who is immunocompromised, somebody who was not yet vaccinated. So it was really to prevent transmission.
It doesn't prevent. Okay, here's the thing. I don't get it. Does it do wearing masks, according to Fauci-Stein or whatever is Franken-Fauci-Stein, does it stop you from transmitting, or does it not?
That's what they suggest. They suggest that it does stop transmission,
Stops
or
you from coughing all over the elevator,
or significantly hinders transmission. But the studies that have been done on this, in terms of the real world, how people are wearing masks, and even some studies where the control group and the experimental group, they're more conscientious about mask wearing than actually exists if you've ever gone to an airport or any other place that's highly populated with a lot of people wearing masks.
I've just been in one.
So all this starts from, you're supposed to start from the premise that masks stop transmission, and I don't start from that premise, because the science, magic incantation, science solves all of our problems, is dubious on it. That's just the fact. Rochelle Walensky then pressed on, okay, you're talking about transmission, you're talking about cases. Because remember, the baseline is you're vaccinated, it prevents serious illness and death. You may get reinfected, prevents serious illness or infected or reinfected, but it prevents serious illness or death. So then where are we, contextually here? Hospitalizations and fatalities. That's what we were trying to slow the spread over a year and a half ago. Slow the spread to prevent.
The fear.
And that's where we're at now.
They're spreading the fear, definitely.
Yeah, well, right. They're not slowing that spread.
So I think it's really important to recognize that as we think about the absolute number of people who are getting infected, that is related to the number of people who have disease, the number of people who are vaccinated, and how well those vaccines work. So it is actually quantitatively possible to have 95% protection from hospitalizations and still have a lot of breakthrough infections if most of your population is vaccinated.
But is there a normalcy? I mean, is the next variant just around the corner? And is that something, that we're always going to be on this stop and start with putting masks on or not?
So I want to just articulate that this was not news that I expected the American people to welcome. This weighed heavily on me to have to do this. But I will also say that this virus has been humbling. I was taking care of patients a year ago. I joined the CDC 6 months ago, and the science continues to change.
I'm sorry, Bret, that's not non-responsive to the question. He said, what is the threshold?
I don't care about your feelings.
What are percentages? It's like, we thought about this it hurts my heart, this sort of, despotism with a smile, this compassionate tyranny.
Sentimental barbarism.
What about the hospitalization rate? And you get that sophistry, that emoting.
95%. She did, the words 95% came out of her mouth.
Yeah,
right?
Essentially, if you have 95% are protected, you still have a problem. Well, I don't think so. And this kind of gooey speak is what generates stories like this terrible, ridiculous, embarrassing story out of the Chicago Tribune. Apparently, it's still in print. I had no idea. Chicago issues indoor mask advisory for everyone over 2. Yeah, they're recommending.
Do you ever try to put a mask on a 2-year-old?
You shouldn't try.
No, but I mean,
I know.
You can't get a 2-year-old to do anything.
COVID-19 cases up nearly 50% in Illinois over the past week. So, first of all, the metric is hospitalizations and deaths, not cases.
That's what you think the metric is.
Well, that's
not what the fearmongers think the metric is.
That's what they were saying the metric was when this outbreak occurred, and now they've changed it, and they're not explaining why they've changed it, number one. Number two, up 50% in the past week, 200 cases a day. So it went from 133 cases a day to 200 cases a day in a city of 2.8 million people, and we're supposed to run around like chickens without necks.
Are people dying as a result of it?
Well,
Are more people dying?
I'm glad you asked that question, because our friend Martin Kulldorff, an actual infectious disease expert at Harvard Medical School, at the same time all this alarm is mounting, the actual number of COVID-19 deaths is at its nadir. In the USA, COVID mortality is now the lowest since the start of the pandemic in March 2020. And he tweeted out a chart actually from Our World in Data. Deaths per million at extreme lows. And so hospitalizations and increase in hospitalizations in some areas of the country, are they a concern? Sure, they're a concern. But only to the extent they lead to high numbers of deaths. I mean, I know the sort of anomalous long COVID cases, but we're really talking about hospitalizations and deaths. Hospitalizations are a concern. You don't want people to get seriously ill, of course. And you certainly don't want people to die. But there's just no indication that that's happening at this point. Jay Bhattacharya, a Stanford medical professor, it's striking that COVID mortality is at such low levels despite the fact that we're seeing an increase in cases of late. By immunizing the elderly and many other vulnerable people, we've provided them with excellent protection against severe disease in case they get infected. Also contributing is widespread natural immunity from recovered COVID-19 patients. Though cases may rise, deaths will no longer follow in proportion. We have effectively defanged the disease with our successful vaccination rollout.
Nature may have already done that by killing 500,000 Americans.
Well,
right?
I mean, it's,
so the most vulnerable are already dead.
Well, it's not a single thing. It's a combination of all of the above. And yet, despite what you hear from Jay Bhattacharya, for example, here's what you hear from Rochelle Walensky, CDC Director, on a federal vaccine mandate.
The best way to stop a new variant from spreading is to have less virus out there, and the best way to do that is to get people vaccinated and to mask up until they are.
Are you for mandating a vaccine on a federal level?
That's something that I think the administration is looking into. It's something that I think we're looking to see approval of from the vaccine. Overall, I think in general, I am all for more vaccination. But I have nothing further to say on that except that we're looking into those policies. And quite honestly, as people are doing that locally, those are individual local decisions as well.
Yeah, thank you for doing the federal government's bidding for us.
I have something to say. All the left, including the pundit class, who screamed endlessly, 24/7, year after year, about authoritarianism. Where are they now?
Well,
where are you now?
They're saving lives now, so it's different. This is, again, this is authoritarianism with a smile and a "we care about you. We're here to save you."
Useful idiots. Sorry, but
Holman Jenkins writing in the Wall Street Journal about this. Unlike the U.S., Britain isn't flipping out about and flipping around in the half dark about what's going on, because they've seen a Delta surge too in the UK. Thanks to biweekly blood sample surveys, the UK government knows how many people have antibodies from vaccination and/or infection. Thanks to surveys and modeling, they also have a good idea how many are currently infected. Invariably, a multiple of those who get a positive test. We don't have that. And this has been pointed out by, again, Dr. Scott Gottlieb, among others.
Could we have it after the 2022 midterm elections?
Well, I mean, again, so comparing the situation in Britain to here is perhaps instructive, considering we've got 164 million people vaccinated. And we pretend like, there's this significant super spreading cohort that is rampaging through the country despite this. Of particular interest, Holman Jenkins writes, are the antibodies of younger Brits, a majority of whom until recent days had yet to be vaccinated. As of the middle of June, 32% between the ages 16 and to 24 reported receiving the vaccine. 60% tested positive for COVID antibodies. Because the older groups rushed to be vaccinated, this helped authorities understand the extent of natural immunity. For the record, 92% of Brits now show evidence of antibodies, which is to say evidence of protection. 92%.
Right.
And in America, Jenkins goes on, weirdly, we have to rely on guerrilla statisticians like Yung-Yang Gu of MIT, who we've spoken with, to know how many might have COVID. Models are imperfect, but they bring us closer to the truth than trackers that currently highlight a total of 35 million positive tests, when it's highly probable at least 130 million Americans have contracted the virus. As for the antibody total that would tell us how near we are to herd immunity, forget it. So the British government has a handle on the percentage of the population that has antibodies, as just described, and our government does not. And so now, as he said, we're groping or flopping around in the half dark about what's going on. And so this is why you have all of this gooey talk and this turnabouts on the various restrictions or recommendations of restrictions for COVID, including with the schools.
We're really good at gooey talk, aren't we, in this country now?
I mean,
it's all about your feelings, and something out there is vaguely threatening, and we have to do something.
And there are no specifics, too. I mean, this is stunning what she had to say, Rochelle Walensky, about schools. The masks for schools. This is, it is Groundhog Day with respect to these policies. It's the same talking points for policies that are all over the place. Same talking points. No matter what their policy recommendation is, it's always the same. This is the best. This is the best we can hope for.
Over the summer, we've had numerous summer school outbreaks that have occurred when masks are not worn. We've had jurisdictions have had to close schools because there are so many clusters happening in the school system. So my primary goal is to get all our kids back in person safely for full-time learning, and to do so and to be able to keep the schools open to prevent those clusters from happening in school. Right now, the best way to do that is to have everybody masked, because we do have disease in the community, and hopefully as we have vaccinations for kids and less disease in the community, we'll be able to scale back on the mask wearing.
We have disease in the community, so the kids have to wear masks. I mean, what is the evidence, again, of transmission in the schools? What is the evidence of kids, or teachers for that matter, getting sick and or dying? Well, put this in context. The same way we put the adverse outcomes, or she puts, the adverse outcomes from taking the vaccine in context. It's a very small percentage. These are overwhelmingly safe. You know what else is overwhelmingly safe? A classroom. And it's a very small percentage in both transmission as well as bad outcomes from transmission, but that's not what she says, and she will not get specific. She just won't.
Over the summer, we've had numerous summer school.
Those aren't hospitalizations and those aren't deaths. Do you have a percentage of kids, young kids, hospitalizations and deaths?
We are following that very carefully. What I will say is
following it. What's the
that,
percentage?
Certainly, the kids do better than adults do. The older people, the more hospitalizations have occurred in demographics that are over the age of 65. But we are seeing illness in some kids who get COVID, and it's illness at the rates or even higher than the rates of influenza. So
hospitalizations at the rates? Death at the rates? Tell the parents what's going on, because they're gaslighting everybody.
Well, at the rates at the rates of influenza. So then, what's the protocol for the flu? If you're doing this for COVID, then what's going to be the protocol going forward for the flu?
Who runs this government? The Chicago Teachers Union? Who runs it?
Well, the not the Chicago Teachers Union, the
right.
But, NEA, Randy.
I want to get paid. I don't want to go to class.
Bret. Try it again. Second try on schools to get specifics.
I think that we have to, when we have seen in schools that when the children come into schools with disease in the community, it can spread in schools if the children are not masked.
And
that's
wow. There's no support for that statement.
Just a general feeling. So how much of this has to do with the midterm elections? Let's just be, come on. How much?
If they think this helps, I don't know. But I mean, I guess to your point, there's some people driving this. There's some people that fear-addled. They've been afraid of their shadow from the beginning, and they continue to be. I don't know, but I don't see this. maybe it's not reaching critical mass yet, sort of when will the revolt come? Maybe it's not reaching critical mass yet, but I think it's not moving in their direction. Pat in Lockport.
Yeah, having listened to you guys and a review of all the stuff that was on the news, I feel like my brain has turned into a marshmallow this morning.
Yeah.
Me too.
But I did want to I want to make a couple of quick points. Number one, if these masks have not worked at 18 months, how damn stupid is anybody to believe that they're going to? Number two, where's the test for the Delta? How do we know that it is Delta? This virus has never been isolated, so how could we have a variant from something we don't know actually exists? Number three, the PCR tests are crap because they're going to discontinue them December 31st. Well, if they're not good then, why are they good now? They've changed the rating or the time. I'm not a scientist or an epidemiologist, but they changed how the tests are being done. And then you've got some clowns that say we didn't have a flu season. Well, you dumbasses, it was all COVID. And where the hell are the parents, too? Because if you are dumb enough to put this crap on your kid's face and expose them to pathogens, you're just as stupid as the crap that is coming out of the CDC and out of the teachers union.
All right.
And as far as one more point.
Thanks for the call, Pat. We got to go. I think the Amish texter summed this up nicely. I figured it out. You have to get vaccinated to prevent the virus, but then the vaccinated must wear a mask to prevent transmitting the virus they're vaccinated against to the unvaccinated. Simple. You got it? Makes sense?
This is Chicago's Morning Answer.
Your show keeps me alive during the week. There's nobody I'd rather listen to between 5 and 9 in the morning than you guys.
On AM 560, The Answer.